Hello, and welcome to the Power of We podcast. I am your host, Nisa Brown Springman, and the founder of Ignite Your Life. Ignite is a women's holistic health, fitness, and lifestyle community. And for the past 17 years, I have had the honor, privilege, and blessing of being the recipient of the wisdom, strength, knowledge, encouragement, and inspiration that comes from being part of this incredible community. And I want you in on that. In Ignite, this is what we call the power of we. The power of we is the philosophy that Ignite is built upon, which is that two is better than one, and that God created us for community and to do life together. In this podcast, I will have conversations with a wide range of women over a wide range of topics that will provide you with wisdom, knowledge, inspiration, and encouragement. So get ready to be empowered, y'all, because here we go. Hello, and welcome to the Power of We podcast. I am so excited to introduce to you our guest and my new friend, cardiologist Caitlin Giesler, who lives in Austin, Texas. And Caitlin is my new friend. I just met her last week at a luncheon that she and I were invited to present at. And I immediately was drawn into the words, that the wisdom, the information that she had to share for a couple of reasons. One, it was all based on women's heart health. Caitlin is a mom like me and so many of us who are listening. She is relatable. Her specialist is women's heart health, and she is also very easy to understand. And so, while a long time ago, pre-children, we used to be involved in a suppers club, a dinner club with my sister and some of our mutual friends. Well, all but three of us who sat around this table were in the medical profession. That excludes myself, my husband, who's a basketball coach, and my brother-in-law, who is a recruiter. And so they would be sitting around this table talking all this medical talk, and we would just be like, we have no idea what they're talking about, and just kind of nod our head or sit there with these blank stares. So that is not what Caitlin is like. Caitlin speaks to us in very simple, easy to understand terms. And so anyway, Caitlin, thank you so much for being here and part of the Power We podcast.
Thank you so much for having me. I'm thrilled. I'm so excited about this.
Me too. This is obviously a topic that is extremely important. Heart disease is the number one killer of women. And we'll, of course, get into that. And I just have to say that embarrassingly, I don't have heart disease in my family, live a pretty healthy life. It's just not something that is super on my radar. So when I hear that it's the number one killer amongst women, that still blows my mind. And so I am so eager to ask you questions and to have you give us all of your heart health wisdom that is specifically for women. Of course, it can always go into a male's life and health, but this is for us, ladies. And
That's
so
right.
First, let us see your shirt, Caitlin. What does it say? Yes,
Warrior.
That's right.
Warrior for women and heart health.
Yes, I love it. I love it. And I should also say, so Caitlin, I know I mentioned this, is a cardiologist, but Caitlin is also the president of the Austin American Heart Association. So I've got obviously a lot of questions for you, but would you mind just telling us a little bit about that role and what you do within the Austin American Heart Association chapter?
Sure. So the local chapters of the American Heart Association are a way to plug in and a way for the American Heart Association to be present in different communities. The American Heart Association, of course, funds a lot of research and does a lot of awareness campaigning. So raising money to fund both of these efforts is really important to the mission. So within the Austin chapter and board, we work on ways to improve awareness, improve heart health in our community, and raise funds to do it across the nation and the world.
Thank you for that. And I should now just give you, let's give a little background into you. All right. Tell us where you live, a little bit about your family, your husband, your children, all that.
Okay. Well, I live in Austin, Texas, as you said, and I am married to Eric Giesler, who is a urologist. We met in medical school many years ago, and we've been married for 20 years. And I have two boys, Michael, who is 16, and Jack, who is 13. And they
wow.
are the loves of my life.
Of course they are. Lots of testosterone. What do you do to balance that out in your house? You have some female animals?
We do. We have a golden retriever, Rosie.
That's so sweet. Okay. So yes, you're a doctor, a cardiologist. And where did you go to medical school, and how long have you been practicing?
So I went to medical school at the University of Texas in Houston and graduated there in 2002. I did my residency and fellowship in Cincinnati, and I moved back to Austin in 2008. So I've been practicing for 15 years.
I'm always curious about this. Did you know that you always wanted to be a doctor? And what was it? What was that kind of defining moment in your life? You're like, this is what I want to do.
I didn't know that I wanted to be a doctor. I think part of it is neither of my parents were physicians, so I just didn't have that on my radar, really.
Mm-hmm.
But I love science. I was a biochemistry major before I knew I was going to be pre-med. And then I had a conversation with my dad one day when I was home from college, talking about like, what do you do with a biochemistry degree? And so we talked through all the options, and he mentioned medicine, and I just started exploring that more, and I loved it. It's like an amazing application of science. I love it.
For you to say the word bio, what did you say? What were you?
Biochemistry.
Thank you, biochemistry. See, I can't even say it more or less comprehend. Majoring in it, oh my gosh, your level of intelligence is on a whole other level. Wow, that is impressive. Okay, so what was it about the heart? Why did you decide to go that route?
So when I was in medical school, when we were learning about the physiology of all of the organs, I loved the heart. It is incredible. It is this big muscle, but it has its own plumbing system, its own electrical system. The way all of those systems work differently and together is it's amazing. It is the center of our bodies. And so it's just something that I wanted to know more about and work with.
And what I find so interesting about the heart is it doesn't look like this.
Right.
It's a whole interesting thing. You're right, with all these chambers and things.
Yes.
Vessels. Sorry, I interrupted you. Keep going.
No, I mean, I was going to say that in my fourth year of medical school, my father actually had a heart attack and died. And I was already on the pathway for cardiology. But it really did change my perspective about prevention and being aggressive in treating things, because we were in Houston in the medical center with like best care in the world, and it just wasn't enough that far in the game. And that also was when I started thinking about, for my sister and me, what do you do as a woman? Like, what's the difference? Is there something that we need to think about? Are we still at risk, even though we're daughters and not sons? So it changed a little bit of my perspective.
So, Caitlin, what were his risk factors? Did he have any? Did y'all have?
He had a very strong family history. Okay. He had high blood pressure, high cholesterol. He had a smoking history. So kind of all the stuff.
Got it. Okay. I remember you talking a little bit about that now when we were together last week, and I'd forgotten that part of it. Okay. So you mentioned that's what, with that instance, the incident of losing your father to a heart attack, that is what's kind of what raised the antennas for you about, well, what about a woman's heart? What do me and my sister need to be thinking about? So you specialize in women's heart health, which is amazing. And so can you tell us a little bit about, just about the female heart and what makes it different than a man's heart?
Sure. So it's been a long journey getting to this point of understanding the differences. When I was in training, there was one little tiny paragraph in our textbook about women heart disease, and it was, how do you treat high blood pressure in pregnancy? That's pretty much all that we learned.
And this was, you graduated in 2008 from medical school, right?
Right.
Or six?
From residency and fellowship in 08.
Uh-huh.
So,
Okay, so
medical school in 02.
Remarkable. That hasn't been that long.
No.
Wow.
No.
Okay.
It's right. There's a lot of gap in our knowledge about heart disease in women versus men. And, I think to start out, importantly, the more we understand about women, the better we can treat both men and women, because we shouldn't all be lumped together. But I would, the way I think about heart disease in women now is that the differences are because of three main things. The first reason that we have different heart disease is we are biologically different, and every cell in our body has a sex. So it is programmed to receive and form disease differently. That's why we respond differently to medications. That's why sometimes our symptoms are different. And then, of course, the biological differences that are obvious. We become pregnant. We go through menopause. Our organs are different. So that definitely can affect our cardiovascular heart health. And then the other thing that is different for men and women is our social and cultural constructs. So the expectations that women feel and put on themselves and that they are held to by our society affect how we receive medical care. Do we want to take the time to go to the doctor when we're taking our family and our parents and our children to the doctors? And maybe we do, but we don't always want to enroll in the therapy like cardiac rehab that requires an hour 3 days a week for 12 weeks. That's a lot of time to pull out of our busy schedules. We also don't enroll in clinical trials because we just don't have time. So, and then a lot of women are dismissed by physicians and providers. We just don't look like we would have heart disease. So we've been passed over for a long time. So that affects the heart outcomes for men and women. And then the third thing is the policies that you and I had talked about before, where women were not included in research trials, especially women of childbearing age, until the 90s. And that was because of some toxicities that had occurred. But yeah, I mean, so we just
not
don't
at
know.
all. No women were involved in these trials until the 90s.
There were women, but you weren't really supposed to enroll like for drug treatments if a woman was of childbearing age because of the potential for pregnancy and exposure. So finally in the 90s, the government realized we need to include women. We have a gap in our knowledge. And so they suggested including women in trials, but really nothing happened until several years ago when finally there was a mandate that if you're receiving money from the NIH, if the government's funding your research, you do have to include a percentage of women. So we're decades behind in knowledge because that's why we don't quite understand whether hormone therapy is safe or not, or at what point you should start it or stop it. And does it help maybe with heart health? So there's a lot to come still now that we're finally getting more research done.
That little negative information to me when you said that was like, my brain exploded. And I was like, no wonder. It makes so much sense.
Yes.
And like, wow, who knew?
I know. There's a lot to think about. So we deserve focused care for those reasons, to understand where we're coming from.
Yes. Okay. So you mentioned, well, I'll get to this, what I was going to say in a second. But so for women, what have we learned are the risk factors for women in having a heart attack?
Sure. So, a heart attack is when some blockage in those blood vessels that are feeding your heart breaks open, right? So I will just back up a little bit about what that means. Your heart is this big muscle, and on top of it, you have blood vessels that feed it like pipes. And those blood vessels are the size of a piece of cooked spaghetti. So they're not big, and it doesn't take a lot to block it up. But in a heart attack, a 20 or 30% buildup can rupture suddenly. And you can go from 20% to 100% within hours because of this inflammation and clotting that occurs from that rupture. So the bottom line is heart disease means there's plaque buildup in these blood vessel walls, and that is caused by high cholesterol, high blood pressure over time. It's an age-related issue. So that's why we talk about traditional risk factors: smoking, high blood pressure, and high cholesterol, and being sedentary, eating poorly. All of those things can increase your risk of that plaque buildup and that rupture process. Importantly, for women, we know that having autoimmune disease, especially lupus or rheumatoid arthritis, can increase a woman's risk of that plaque development. And women tend to have those autoimmune diseases at a much higher rate than men. So that's why it's a risk factor that we look at. Women who have had preeclampsia or preterm labor or gestational diabetes are at increased risk of developing heart disease later, because there is a change in your blood vessel that occurs at that time, and it increases your risk of developing the plaque. So those are some unique risk factors that women have.
So there are two women in Austin. I won't name their names because I did not get permission to do so, but who were and are still the picture of health. This was within the last 10 years. And they were in their 40s, maybe early 50s, and they both had a heart attack. And that was my first antenna went off up, whoa, wait a second. How in the world did that just happen? And so would you say that most of the time for those type situations, it is a hereditary factor?
Yes, most of the time. Mm-hmm. I would say, really women over 65 are at increased risk of having heart disease and heart attacks. And so that means the typical age-related, what we can expect, when we can expect, would be after 65. Okay. And that is more outside of a genetic family predisposition. But if it happens earlier, there's usually some either genetic predisposition, or there are some rare causes of heart attacks that are related actually to pregnancy and to menopause that can occur earlier for women. But by and large, it's either family history or tends to be age related.
Okay. So, and really you said women over 65 is when the risk goes up. Correct. Significantly. Okay. So you mentioned smoking, high cholesterol, and high blood pressure being three things that increase your risks of having a heart attack. So then, what are are there other things besides those three things that you feel like women need to do in order to help reduce our risks of heart disease?
Yes. So there are 4 things to think about. The first is no smoking. Okay. The second thing to do is exercise. Exercise makes a huge difference. And what it does is it helps lower your blood pressure. It helps lower your cholesterol. It also helps your blood vessels be healthier. They get more elastic and less likely to get stiff and cause buildup.
On that note, so exercise is a huge stress reducer. And I know, would go across genders, but stress is a big, it creates all kinds of disease in the body, creates inflammation producer. What is that connection between stress and heart disease?
So we are, I think there's a few things to think about. The issue with stress is, just like you're saying, it's inflammatory. It's kind of hard to quantify that or measure the amount of inflammation and the amount of stress that somebody's feeling. But what we know is that when you are feeling stress or under chronic stress, you're not sleeping well. which raises your risk. Your blood pressure goes up, which raises your risk. You tend to eat poorly, which raises your risk.
Totally.
So it affects so many of these other risk factors. But what we actually have an article published this week in the Journal of the American College of Cardiology with research that we did on heart attacks in women, showing that women with heart attacks have higher stress levels than the general population. And so that in and of itself is a risk factor, aside from blood pressure and cholesterol.
Yes.
So the feeling of stress.
Yes, for sure. So right now in Ignite, and we always focus on these things, but we're making a big deal about sleep, 7 to 9 high quality hours of sleep. And that's not easy for everybody. I mean, I don't even want to pretend like that is like, well, just go to bed at 9 and wake up at 5, like easier said than done. But now we have science behind the importance of sleep. And you're exactly right. When we are sleep deprived, our body just naturally starts craving carbohydrates in the form of sugar. Like I always like to say, and I'm not saying this because I've read it, I'm saying this because I've experienced it in my own life. Like I'm not going to grab that healthy apple, that healthy carbohydrate. I'm going to grab something crunchy and salty and probably sweet at 12 o'clock at night.
Correct.
And then I don't get a lot of sleep. And I do feel we just posted a blog post about sleep. And when I am sleep deprived, or if I have a night of not a lot of sleep, I wake up with a pounding heart. Like I can feel that my adrenaline, it's like it never emptied out of my body or got back to that healthy state. And I'm still in fight or flight. And then within days, I get mouth sores, my immune system tanks. And so I can see like if that is perpetual in someone's life, and you take a single mom, someone who's caring for someone sick in their family, or just a really busy woman, that's every single one of us, like it could easily happen and turn into major stress and then a heart attack.
Yep.
I can see that.
Yes, you're right. And so the 4 things that women can do, men and women, no smoking, exercising, getting good sleep, and eating healthy foods. And I think that you're exactly right in describing how we all get wrapped up in that stress. So the other important thing to think about is not to take that on as one more stressful thing, because it's very hard to add exercise and eating healthy to your list of to-dos. So you don't have to be a vegan marathon runner to avoid heart disease.
Wait, hold on. Say that one more time, because so often what we hear, I was just experiencing this today. I was having a quick conversation on the phone and I was like, did I hear what she just said correctly? Or I'm like, no, you're making it something that it's not. Like, go back to the facts of what was just said and don't make sure you're hearing the truth. So the truth is, I do not have to become a vegan vegetarian and sign up for the next triathlon in order to reduce my risk of heart disease. Yay.
You're exactly right. Every little bit helps. So pushing the good stuff into your diet, lots of plants, the more the better. Cutting the junk out makes a huge difference. And just little things, eating a salad on the side instead of fries, choosing the healthier options, try some veggie meals here and there. But it's just, we get so overwhelmed and then you just forget it. The little bit makes a difference. Even walking for 10 minutes makes a huge difference.
I was just going to say, and I get stuck in this mentality of like, it has to be 100%. But in reality, I know that that's not the truth. And so you're right. If it's just 10 minutes, 3 times a week, going on a walk, get outside, get some fresh air, some vitamin D, move your body more than that is progress. And that's moving in the right direction.
That's right.
If there was 0 last week,
that's right.
Just a little bit of progress every week. So food, you mentioned this last week and I thought it was so good. because again, we tend to think in extremes, at least I do. And so as it relates to food, are there certain things, you said lots of greens, lots of veggies. You'd mentioned last week too, like 30, 30, 30.
Yes.
Can you give a little bit of info about that?
Sure. So I think, when we're trying to figure out where to begin with all this, how do I really reduce my risk of heart disease long term? Think 30 is really helpful. And that means you want your blood pressure less than 130. That top number needs to be less than 130. You want your LDL bad cholesterol less than 130. You want to exercise for 30 minutes, 5 days a week is the goal. You want your body mass index less than 30. And you want to eat 30 fruits and vegetables a week. So again, just push the good stuff in, which seems like a lot, but it's doable. And the last thing is to stop and take time at 1:30 every day to center yourself. And that's a little bit of stress moderation, but just some way, whether it's prayer, meditation, just deep breathing, where you center and realign those stress systems in your body. All of those things make a difference.
Well, and you could double dip. You could take a little 30-minute, 10-minute, whatever walk outside. Yep. And you know how I feel about this thing. Like, leave it.
Yep.
Because that is a stress inducer. And so leave it, go get fresh air, breathe, get centered, pray, meditate while you're walking. And you come back and you've checked off 2 things on your list.
That's there right. And you've gotten healthier.
Yes.
Yep.
Okay. Tell us the difference between heart attack symptoms in a man versus a woman.
Sure. So, the Hollywood heart attack is severe chest pain radiating down the left arm. That's what we've seen all the men on TV have. And so for a long time, women were presenting to the emergency room with heart attacks, but they didn't look like a man, of course, and they didn't feel like severe pain radiating down the arm. And they were overlooked. And now we realize that women can often, instead of severe pain with left arm, it's pressure and discomfort. And the discomfort often radiates to the neck and jaw. Women can often feel just short of breath and kind of clammy. And so it's maybe a little bit more subtle. And we used to call this atypical chest pain because it was atypical for a man, but it is very typical for a woman to not have severe pain. Most women tell me it's not painful, it's pressure and discomfort. And then again, the radiation to the neck and jaw is pretty common. So if you're having a heart attack, your heart muscle isn't getting good blood flow and it just doesn't pump very well. So you don't have kind of pain and then you can go walk across the room easily or walk up a flight of stairs. That's not typically heart attack. If you're having a heart attack, you feel symptoms, but then you also just feel like awful. You cannot get up and move and go.
So that's the part of these risk factors that concerns me because I'm go rest, push through, like, yes, pay attention to your body. But I would be total transparency, the last person to show up in the emergency room to say, I think I'm having a heart attack because I don't want to, like, it's an inconvenience for my family and for me. And I don't want to, be alarming or overly dramatic. So to hear you say those things, like, it's more than just, feeling like you have the flu, kind of like clammy. We really should be paying attention to the tightness in our chest and some tightness and discomfort in the jaw area. Like that combination along with just feeling lousy are the big things. Okay.
Yes. And difficulty breathing is typically part of it. You're not getting good circulation. So very often you just can't get a good breath.
Yeah. And for somebody who has no trouble breathing ever, is not, who's in good shape, good physical shape, if you were to experience that, like, pay attention to it.
That is right. And so going back to your point about you don't want to bother somebody, you don't want to seem foolish by going to the hospital. If it crosses your mind that this could possibly be a heart attack and you are not feeling well, it is appropriate to call 911 and go to the hospital. This is an emergency and it's fixable, but the sooner you get taken care of, the better. So it is totally possible for a 40-something-year-old woman to have a heart attack. And again, if it crosses your mind, you do have to call 911 and go to the hospital.
Thank you for that clarification, because that's, again, I've always it's always been in the back of my head until these two women in Austin who were perfectly healthy and young and didn't have any risk factors, had heart attacks. And one of them was the same thing, mom of 3 children. She's like, oh, I just don't feel good. I think I'm going to go lay down. And then it started getting bad. And so anyway, I need that reminder. And I know people who are listening need that reminder too, to just don't just go lay down and think it. If you're feeling a shortness of breath, tightness in the chest, and those other symptoms. So I shared with you, my husband has a history. His mom had heart disease, died of a heart attack, and he has college basketball coach, first time head coach, a little stressed. And now that I know that we could be living with plaque in our hearts. I mean, I'm 46, he's 54. And, these are things we now have to start considering, so that we can obviously stay healthy. But the first thing that comes to my mind is we got to be alive for our children, And so then the thought occurs to me, well, okay, how do I even go about finding a cardiologist? And what am I looking for? What questions am I asking? And how do I know that he or she is the right fit? Just to, have a starting place with. So what recommendations would you give someone who doesn't have a cardiologist, but they recognize it's kind of something I need to start looking into now, just to have?
Sure. So the big thing is, yes, middle age, this is the time to get an assessment. And that means you need to figure out what your numbers are. You can go to your primary care doctor and get a lot of this information. But when you go for an annual exam, which you should be going for sure in your 40s, and some gynecologists do it, but most don't, I would recommend having a primary care doctor. You need to make sure that you know what your blood pressure is. You know your cholesterol panel. You know your blood sugar. You've got to look at those numbers and then talk to your provider. You can do, again, with a primary care physician initially, and then go through your risk. What is your pregnancy history? What is your family history? What is your smoking history? Go through all of the things that could increase your risk of heart disease. And then if you feel like you don't have your questions answered or you don't have a good handle on whether you need to do more testing or not, then that's when you can make an appointment with a cardiologist and just get a risk assessment. You're not wasting anybody's time. We're here to figure it out. It's not something you have to figure out on your own. Maybe it's just a one-time visit and getting an assessment. The other thing is, when you do have risk factors, or for women over 50, men definitely over 45, there's a screening test that you can do, which is a CT calcium score. It's a CAT scan of your heart. And what it does is look for calcification of the arteries of your heart. So if you have some plaque buildup starting, then over time it gets calcified, and we can measure the amount of calcification. If you have zero calcification, you have no plaque, little to no plaque, your risk is very low. If you have a calcification number of 400 or higher, then it's a considerable amount of plaque buildup. But we're ahead of the curve. We can treat it. We can get you treated. So if you're on the fence, if you're not sure, or if you're a woman over 50, then this screening test is a great option.
So for someone like myself who doesn't have any heart disease risk factors, does not have it run in my family, would you say that, I mean, again, I need to go to I don't even have a primary care doctor. Sorry.
Most women don't.
Yeah, I don't. I haven't felt like I needed one, but of course I need one. Just to, get my blood pressure, my cholesterol, my blood sugar, all of these things checked. And so describe the blood sugar piece, because you haven't touched much on that.
So diabetes is a risk factor for heart disease. It's an inflammatory disorder and it causes plaque to build up. So diabetics are at higher risk for heart attacks. And so knowing your blood sugar is very important. If your blood sugar is high, then that can be diabetes. And getting it treated greatly reduces your risk. So that's one of the numbers to know on your general exam. Okay. So, at this point, you should have a primary. And again, yes, getting all those blood tests done and asking the questions. If your risk is low, you definitely don't need to do a bunch of other testing.
So we talked about this for that. Did you call it CT scan? The heart?
Yes.
I was just curious because I would like for you to talk about plaque. I learned something the other day while talking to you, or actually eavesdropping on a conversation you're having with someone after the lunch about plaque. And so I was very interested. And even if I don't have any of these risk factors and all my numbers turn out under 130 and they're good, then or 30, then I'm still interested in this CT scan on my heart, because I would just be curious to know if I have any kind of plaque buildup going on in there, because seems like it can sneak up on people. Like, whoa, I thought I was feeling fine. That being said, and you said your primary care physician would have to give you a referral to see the cardiologist for this assessment, but that is something that we all can get. And then can you explain a little bit about the plaque and what I overheard you saying after this luncheon about getting rid of the plaque, or the idea of not being able to, or the thought that you can or can't get rid of plaque?
Sure. So just in general, as far as that CT scan goes, it is something that does require a doctor's order. Typically, your primary care doctor can send the order, or your cardiologist. They're good every 5 years. So if you have a 0 at age 50, then I would recommend doing it again at 55. It's kind of like a mammogram for your heart. So it's a good screening test. If you have heart disease, or you've had a heart attack, or you have calcification on one of your scans, you don't really need to keep doing it. It's not how we monitor progress, but it's a good screening test. So that will answer questions, I think, for a lot of people. As far as the plaque buildup itself, again, you have these blood vessels outside on top of your heart. They're like pipes, but they're alive and elastic. And the plaque builds up over time on the inner wall, actually, of the arteries, and then starts growing into the lumen, or the space. And that plaque, it doesn't melt away over time with medication or with stents. But what we do is control it. And so the plaque itself is an aging process. It takes decades for these plaque areas to build up, but it's built up, and it's built up kind of like the pipes in your house. But again, you can't roto-rooter it out. It's there.
I mean, that right there, that statement blew my mind. I'm like, well, what the heck? I thought you could, get really healthy and then you're not going to have to worry about plaque anymore. But once it's there, it's kind of there. It's just a matter of managing it.
Correct. That's exactly right. You're right. And we're managing it. And the good news is we can. It makes such a difference to get treatment. And that treatment includes healthy lifestyle. So adopting a healthy lifestyle does make a huge difference, even if you already have some plaque buildup, to reduce the risk of building more and that rupture process that causes a heart attack. So healthy eating and exercise.
Okay, awesome. So the goal is, like, once you have plaque, it kind of is what it is. The goal is to stop the expansion of it.
Yes. Yes.
Okay.
You can live a long, normal life with plaque. We want to stabilize it, and we don't want it to keep building up. So, right, the healthy lifestyle, controlling your numbers, so getting really good blood pressure control, good cholesterol control, and good blood sugar control makes a huge difference. And so that was the other thing that we were talking about last week was if you have heart disease, then part of the reason that we prescribe a statin or other cholesterol medication is that we want to lower your cholesterol numbers because we know that makes a huge difference. But these medications actually work on the plaque itself, and they stabilize it and they prevent buildup. So in conjunction with healthy lifestyle, it's a great addition if you have heart disease.
Okay. That was such good info. So as far as finding a cardiologist, what you mentioned when we were having this pre-podcast talk, you mentioned it's so important to be an advocate for ourselves, and not to generalize, but women aren't the best at that. Being one, I know. Just like I would kind of potentially, I wouldn't now, but before, like dismiss, like not feeling like I don't want to cause a stink or anything. Same thing. We'll just kind of go and listen, and then we leave. We're like, I didn't learn anything. I don't know if this is the person for me, and I didn't get any answers. So how do we find the right cardiologist fit for us? What kind of questions do we ask? How do we advocate for ourselves?
I think that the main thing is you need to feel like you were heard, and then you need to get your questions answered. So, you and I talked a little bit about this the other day, but there are a couple of things that I think about seeing a patient and that need to occur, I think, in your regular office visit. The first thing is, are you having symptoms? Is there something that's bothering you? Do you have pain or palpitations or passing out? What is going on? And that needs to be investigated with your doctor, either with testing or a physical exam, interview, all of those things. Let's solve that problem. Make sure it's nothing dangerous, or whatever it is, let's fix it. And once you've addressed the acute issue, then the other part of the conversation needs to be, okay, what's my risk for heart disease long term? Maybe I'm having this high blood pressure or these symptoms right now and we're treating it, but what is my risk? How do we monitor my risk long term? Those questions need to be answered. And that conversation is so appropriate. And if you're not getting your questions answered, if you go away and you're like, I don't know why I'm feeling this way. They said everything's fine, but I still have symptoms. You need to call back or ask more. Because a lot of times when we see patients and maybe they're having palpitations, they feel their heart racing. We do a heart monitor. It's something that we can see they're feeling, but it's not harmful and it's benign. People are told it's fine. You're fine. But it doesn't really answer the question. Like, I'm still feeling my heart racing. What can I do about it? So it is not inappropriate to demand more answers. And again, if you aren't sure about your risk, you don't understand your blood pressure or your cholesterol profile, keep asking. It's what we're here for.
So you mentioned something that, again, made my antenna radar go up, which is, if our symptoms are dismissed or we're having heart palpitations and all that being said, which I just said nothing, there is a menopausal component, a hormonal component to all of this.
Yes.
That is specific to females that I would imagine if there hasn't been a whole lot of research done on women's heart health, then there's probably not a lot of data out there that really dives deep into menopause and hormones and all the things that only women experience that affects our heart. Can you touch on that a little bit?
Absolutely. So the big thing with menopause and heart disease is that the risk of developing heart disease is higher after menopause. And that is because your estrogen that was protecting you for so many years is now depleted. So we lose the protective estrogen. That can affect our blood vessel health. They tend to get stiffer with the loss of estrogen. It raises our blood pressure. Our cholesterol profile goes up. It gets worse with menopause. So those things we know. And the important thing about that, of course, we can't fix the fact that we're menopausal, but being really aggressive in treating them with lifestyle and medication makes a huge difference and reduces the risk. So it's not all bad news, but just being aware, all of a sudden you go to the doctor for your annual visit and your blood pressure is higher or your cholesterol is higher and you haven't done anything differently, it is very often menopause related. So that's part of it. And the other thing is that for sure, menopause causes all kinds of crazy changes and feelings and symptoms in our bodies. And it's confusing because it's also the time in our lives where our children are in maybe high school or college. Our parents maybe need more help. And our career is at the pinnacle. So our career demands are high. So our stress levels are high, our demands are high. And maybe that's why we're not sleeping, but it also could be hormone related, or you're having palpitations at night or during the day. Is that related to the high stress or is it menopause? Very often it is menopause causing these symptoms. And so having the conversation again about, is hormone replacement therapy appropriate, or are there other alternatives for treating these symptoms, is super important because it's not normal to feel your heart racing. It's not normal to have these other changes. And so I don't know that all women have to put up with it the way we do.
You're right. And it is so interesting because it kind of is the perfect storm, right?
Yep.
Like, so I'm not a believer in like anticipation of the worst. Though, like, just be aware, this is a very common season of life thing.
Yes.
That occurs when all these, I don't want to say balls start to drop, but just big life things start to happen, including the physiology of your body.
Yes.
And just that alone would be enough, I mean, to cause a woman's, to feel like their hair is on fire and they're running around their house. But nonetheless, we've got all these other pretty predictable life things that are going on too. I have a friend who saw you, and she was just convinced that she had something wrong with her heart. And I know you can't talk about her, but she was so relieved to go and talk to you, and you say, nothing's wrong with your heart. I think it's just some hormones, and you can rule out, you're not having a heart attack. Your heart is good and strong and healthy. It's just some hormonal changes.
That's right. That's right. And so that's my job. I think a lot of people are afraid to ask or bother anybody or think that their symptoms are not important, or they're worrying too much. But if you just are confused or not sure, that's the conversation to have with a physician. And maybe you need some testing done. The objective testing gives you the data. Let's figure it out. And maybe we can fix it or not, but having that information makes such a difference.
Well, and just to rule out that your heart isn't, like you're not on the verge of having a heart attack, and getting information will make your heart feel better in general.
That's right.
Will cause that stress to go down a little bit. Okay, we have covered so much. So I'm looking back over my notes. Okay, younger generation. Tell us a little bit, or actually, hold on. Before we talk about the younger generation, what kind of trends, again, I know that we have not been studying women's heart health for very long, but what kind of trends are we seeing? Are we experiencing less heart disease because awareness has gone up, hopefully, or what's happening?
So I show a graph pretty frequently when I give talks to different groups, but the heart disease and heart attack trends for men and women for a very long time, actually, starting in the 60s and 70s, the male trends were improving, like significant decline in deaths. And the women were going up, up, up. And so there was this huge gap for men and women. And it wasn't until the 90s when we realized, actually in the 80s, we realized women were dying of heart attacks and experiencing heart attacks to begin with. But in the 90s, that's when the red dress and go red campaigns came about. And so there was awareness all of a sudden for the community and providers that women can actually have heart attacks. So with that awareness, the death rates improved significantly, and the trend lines kind of came together so that the death rates for men and women were pretty similar. Unfortunately, they're both climbing now for men and women. And this was even pre-pandemic, but I think that the pandemic had a big impact on that also because of all of the stress and the bad habits. And so
the extra alcohol. And oh my gosh, the list goes on and on and on and on.
Right. So the trends for heart disease are going up now, and they're going up also for younger women. And a lot of that is just lifestyle.
Is it within the younger generation? Is it more so an obesity, diabetes?
Right. I mean, it's, the things that lead to that, right? Poor eating, lack of exercise, high stress, no sleep. And then you develop diabetes and you gain weight from that for sure.
Man, you can just so easily see how that would happen. It just so easily, because it's all so connected, as we talked about earlier, just how slippery of a slope it is. And it's just this snowball. And so if you're living in a stressful environment, you don't have, possibly you don't have resources, or you are taking care of, even if you're not very old, parents, and you're, whatever the case may be, maybe you're a guardian, you're a young guardian, and just, there's not a lot of time to think about taking care of yourself.
Right. So I think that the message for women of all ages is that some seasons in our lives are crazy. And, you can't always control the stress or get out of situations. But if you are in these situations and you notice that your blood pressure is going up or your cholesterol is rising, that's what the medication is for, honestly. Maybe you only need blood pressure medication for this season because you just can't take care of the things that you need to. It's worth treating it. It makes a huge difference in supporting yourself. And
sorry, go ahead.
Well, that's all. I mean, and then you can get back on the wagon.
So when we're talking about younger generation, what age bracket is that?
30s to 50s.
Okay. I had a thought about that. And then, so we're seeing heart disease numbers go up across every age group, demographic. We're just ticking up in the wrong direction.
Right.
Okay. That's really unfortunate. Okay.
Well, that's why we're here, girl.
That's right. You know what?
Get the word out.
That's right. We can take care of ourselves, and that means we can help, others take care of themselves too.
Yep.
So that's the good news. Okay. So, if I wanted to just start digging deeply into heart health research and information, do you have some resources that you recommend people go to?
Sure. I think for general information, the American Heart Association, heart.org is a great resource. There's good patient information. The Mayo Clinic has great information about heart disease in general and about women's heart health and women's risk factors. There's also an organization called womenheart.org that has great resources for women. So I think those are all good starting points.
But because this is a new thing, there's not just a whole heck of a lot out there, which leads me to, currently you are not practicing. you tell us a little bit about what you're looking into?
Sure.
Potentially.
My vision is a women's heart center and better heart care for women. The way that we were talking about earlier in the podcast, that women deserve better care. We need focused care that looks at the biological differences, the social differences, and is constantly updating the information that is out there. There's a lot of research coming out. So, for a long time, I had a practice in a system, and it was a great, successful practice, but I know that I can build something bigger. So I'm working on how to do that and developing my vision for that.
Super major, big high five through the screen to you. I've told Caitlin this a couple times. Like, I am supporting you. I don't know that means anything, but I say, you go, girl, because we cannot have enough passionate, not just healthcare providers, but, just caregivers, professionals, whatever. If you're feeling this heart tug to move in a direction, we have to pay attention to that. I think that's God, like, hello.
Yes.
Ding, 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 ding.
That's right.
Pay attention to that. I planted that in your heart for a purpose. And I would say that had taken a lot of guts to walk away from a practice that you have worked so hard for and in, walk away from your patients. So I don't even want to, even knowing there's something, like I have a vision, I can see, I know that there's more that I can do, but to walk away, that hurts. That hurts me, my heart for you. And so just given that you're trusting that little ping in your heart, that little God whisper, we can call it, I think it's pretty amazing. So I can't wait to see.
Thank you.
What happens.
Me too.
Yeah, I know. I love it. Okay, so back to the young women, age 30 to 50, because I knew I had a question I wanted to ask you. That is just typically not an age group, I would say, that so maybe they're a little overweight, maybe they have diabetes, maybe they don't, but what would you tell, for that woman who's 65 and older? That's a no-brainer, right? I know that my risk automatically increases at 65, but what would you, for that woman who is 30 to 50, what would it be, what would it take to get her to go see her healthcare provider, to then hopefully see a cardiologist if that was necessary? Does that make sense?
Sure. I think that you're exactly right. When you are at increased risk because of age, or you already know your family history, then it makes it a lot easier to get the information and to seek it out. But I think we know that heart disease takes decades to form, and it is starting in your 30s and 40s when we think we're invincible, at least in our 30s. But that, you should know what your blood pressure is. You need to know what your normal blood pressure is, and you should have a cholesterol panel at some point. You don't necessarily have to do it every year in your 30s, but you definitely need a baseline. What is your blood sugar? What's your cholesterol? And what's your blood pressure? And those are things, just like your weight, you should know those numbers in general. You don't have to obsess about it, but know it.
Well, because I believe in honesty. I don't know any of that. So thank you for reminding me.
You're welcome.
I just know I feel good, thank you. You're right. That needs, so let me ask you, between that 30 to 50 range, are we seeing more heart disease, or are we seeing more heart attacks, or are we seing all the above?
Both. Yep.
Wow.
All of the above.
Okay. Dang. Okay.
Yeah. And it's preventable. So even though nobody really wants to know,
Yep.
And I'll
Yep.
tell you, I think a lot of people feel ashamed if they have high blood pressure or high cholesterol or their weight's not where it is. And so they don't want to go to the doctor. They don't want to know. They feel like it's their responsibility and their fault. But there are so many factors that are involved in these things. And no matter what, it's treatable. So just knowing that it's not your fault, but we need to address it is really important.
Or maybe you've made some unhealthy choices.
Yes.
They're all reversible. You can
That's right.
change all of that. It's like I gave my husband, because he's a perfectionist, a giant eraser that said like make big mistakes, something like that. And I like to think that's just the life experience. We are not going to be excellent at everything. It's an impossibility. We were not designed to be excellent at everything. Some things are going to slip. Like me, I'm not a numbers person. Makes my numbers, I don't do them. I will avoid them. And it gets me in trouble when I do. And I've learned how to not avoid them, but it took me a long time. So that being said, it's a matter of just getting the information, acknowledging it. This is what it is. And then trying not, like knowing your blind spots too, just trying to not repeat the behavior, but you can't do anything with it if you don't know the facts.
Yes.
Facts don't lie. Mm-hmm.
You are exactly right. That is very well said. I totally agree.
Oh, well, thanks. Glad. Okay, so I'm sure the people who were listening are like, oh, I've got this question. I was hoping she would ask this, and I just didn't. So here is what we hope that you will do if you are listening and if you have questions for Dr. Giesler. We would love to do a follow-up podcast with your great questions. And so email me I'm going to give you 2 email addresses. Send them both. They all go to the same place, but every once in a while one fails. And anyway, it's Neissa, Neissa, at Ignite Your Life Now. Or here's the other email address, Neissa, Neissa, Springman. Neissa B as in Brown, Springman, SPRINGMANN at gmail.com. So that's Neissa at igniteyourlifenow.com or Neissa B Springman at gmail.com. Send your questions to those email addresses and we'll do a follow-up podcast and get your questions answered, because this is just such a fascinating conversation. And again, I know those who are listening, Caitlin, thank you for talking in such a way that we can understand. So thank you. I mean, you have not said one thing that's gone over my head that I'm like, I just really feel like an idiot because I don't know what she's talking about. You have so simplified it. So thank you very much.
You're very welcome. I appreciate it.
For not talking biochemistry to me.
I don't really remember that.
Just gives me the heebie-jeebies. Thank goodness for those of you who love this kind of stuff. We need you. Okay, we have rapid fire questions. But before we get to that, is there anything else that you want to say or add to this conversation?
No, I don't think so. I would love to hear what questions people have and what we maybe didn't cover enough or didn't make clear enough. And so I would love to visit again. So thank you.
Yes, me too. I love this. Okay. So as Caitlin referenced at the beginning, she is a mother to 2 teenage boys. Give us some teenage boy parenting wisdom, please.
I mean, disclaimer, this is in process. So,
of course, yes, always.
But, I think that some wisdom that I heard on a podcast one time has been very helpful for me as a mother. And it was an interview with George Zimmer, who did the Men's Warehouse. He started that company. And he talked about how his mother always told him what a special boy he was.
Mm-hmm.
And not that he was better, but he was just special for being who he was. And it didn't have any qualifiers. And he says that confidence that he always felt from knowing that just helps him walk into the room knowing that he can take care of what he needs to. He knows that he will be successful in things that he pursues. And so I always try and remember that when I'm parenting and talking to my boys, just tell them how great they are, not for having achieved or not always fixing things, but just having that confidence, I think, will make a big difference for them.
It's so ironic that you say that, because just this morning I landed on this 4-minute interview that was done a year ago. It was Toby Mac. He's a Christian musician, and his son, his oldest son, maybe this was 3 years ago, died of an overdose. And it was a random thing. It was just, he was not an addict or anything, just, one of these terrible things that we know happens. Yeah. And he was talking about grieving the loss of his son. And the last text message that he had from his son was his son thanking him and saying, "Dad, you always make me feel like a rock star." Ugh. And so that just piggybacks on what you just said. And then hold on, I'm going to grab a book real fast. Oops, off of my nightstand if I don't knock everything over first. Hold on 1 second. Because I'm reading this book called Strong Mothers, Strong Sons. Have you heard of it or read it?
I have heard of it. I haven't read it.
Yes. So this was just recommended to me because my son's 12 and I'm just waiting for the day he's going to wake up with armpit hair.
So crazy.
I did not grow up with brothers. I'm not prepared for this
at
all.
Crazy.
I mean, I turn into a 12-year-old girl when I start thinking about him going through puberty. And so, and it also breaks my heart to think about, because he's a lover. Also breaks my heart to think about the day that he's not going to just be loving me, loving on him.
Yeah.
And so this friend said, I'm going to recommend a book that her son has just recently gone through puberty. And it was all about strong moms, strong sons, and the relationship that moms have with sons, and just what to expect going through that process. And man, are these boys tender or what?
Yes.
I had no idea.
Yes. It's
Holy
so
cow.
crazy. Yes. It's so great, but yeah.
Yes. So anyway, I love what you have to say.
Okay, well, that's good to know.
Yes.
I'll look it out. Look for it.
Okay. It's really good. Okay. You're married to a urologist. So we got 2 doctors in the house. How's that?
Yes. It's awesome. It's great. We both love what we do. And I think our dinner table conversations are probably different than most people. But but it's amazing. It's been great. Our kids, they hear not crazy patient stories, but they're aware of all the things.
Yeah, they're probably know all that medical talk because they've been around it for so long.
Yeah.
Okay, you've been married for 20 years, did you say?
Uh-huh. Yep.
And so what kind of marriage wisdom can you give us?
I think it's actually pretty similar to the parenting. We are each other's biggest advocates, and we have these crazy jobs and high stress and kind of demands, but we definitely have each other's back all the time. And it's not blind. If there's something we don't agree with, then we will talk about it. But just knowing that person has that's a big reason that I could make this change in my career is he has my back. He believes in me, and I'm the same way for him. So we come home and it's this great place to be.
That's so wonderful. Yeah. I got you, boo.
Yes. For real.
Yeah, no, for real. Yeah. Sometimes when Russell and I will be asking him something, and this was not too long ago, I was like, I didn't ask him something. I was just very gently trying to interject my opinion because he's first time head coach, been in coaching forever and ever and ever. But I was just like, so I want you to know first, I am your biggest fan, and this is not coming across as a criticism. It's because I'm your biggest fan. So please, and I can take things defensively, so I don't want to act like he's the only one, because I knew he would hear it in a way that was like, you're just attacking me. Like, no, I am your biggest fan forever and ever. Doesn't mean I'm always going to agree with you. We're always going to tell you, I'm not going to lie to you, but I'm your biggest fan. So I'm going to tell you the truth. Okay. What is your favorite book and why?
I love reading, but my favorite book is probably The Count of Monte Cristo, which I read a long time ago and then I reread this summer.
Oh,
I just love it because I love character books. I love like epic novels, the twists and turns of the story. It's so interesting and smart to me. I love it.
How many books do you read a month? I bet you're a book wizard. You just go through them.
Probably like maybe two or three.
Okay.
Two.
Okay. Do you buy them?
I buy these really big books.
Okay.
Both.
Okay. Yeah, I've learned that my avid friend readers, they go to the library because they read books so fast that it would not at all be it would be counterproductive to buy all of these books and then they read in a day. I'm not that reader, but for those of you who can read big giant books, a couple a month really blows my mind. But I'll have to read your book recommendation. I've heard great things about it. Okay, how about your favorite quote?
I would say it's Ruth Bader Ginsburg, that women belong in all places where decisions are being made.
Got it. Good one. What about, I asked you, or if you're a concert goer, and you said yes. And I know there in Austin, you have access to that incredible music scene. And now that Moody Theater is just like bringing somebody in a couple times a week. I mean, there's so many options. What was your favorite, or what was your favorite concert and why?
I think one of the most, I don't know, I mean, I love them all. It's such an amazing experience, but probably one of the most memorable was when we got to see Jon Batiste do his Austin City Limits taping for the show. It was so good. He was just like in it and everybody was feeling the music. It was just such a great experience. He's so talented.
I've heard so many fun things about those live tapings. They're just so
great.
Cool.
Yes.
Okay, 2 more questions. What would you tell your 21-year-old self?
Like I wouldn't want to change anything about where I am now, so I would hate to change how I got here. Yeah. But I think I would say give yourself a break, that taking care of everybody is great, but you have to take care of yourself too.
And sometimes that just takes some time, right? Some wisdom to figure that part out.
For sure. Like, what does that mean? Yeah.
Yeah. What is that? Okay. So I've asked you teenage boy wisdom, teenage boy parenting, mom wisdom, marriage wisdom. What's the best wisdom you have ever received? Last question. I know that's a loaded question. It's like impossible to answer.
It is so hard.
I know.
I'm like, every day, this is wisdom that I needed, right?
Yes.
But, I think that something that changed my perspective as a female cardiologist, only 15% of cardiologists are women. So it can be a lonely journey. But I read Lean In way back when it came out. And I know it's kind of a controversial message. But one thing that really struck me with that was that women deserve a seat at the table, and that we tend to sit on the periphery, like literally in a meeting or a conference room. I would always sit on the outer chairs, and the recommendation was sit at the table. You deserve to be there. And so I did. I felt like, okay, now I can actually be part of this meeting, and I should feel like I deserve to be here. So it's good advice at that point to know that I deserve it.
Mm-hmm. I love that. And that is just, it goes back to women and taking care of ourselves. Like we're the first to put someone else first. Yep. We're the first to take a backseat. We're the first to dismiss our symptoms. Mm-hmm. Right. So it's who we are. I've always said this. I said this when I was developing Ignite. We are nurturers by nature. Yep. And we so often forget that we too have to be nurtured. And it looks a lot of different ways. But in order for us to be our best and be the ultimate nurturer to all the people that we love and the things that we love to do and give to and our passions, etc., we have to make ourselves a priority. And it's not a matter of selfishness. Right. It's selfish. You know, like you've got to think about your own needs. I mean, just like the speech that we get when we're flying with our children. Put your mask on first and then take your kids. And so it's so interesting because there's a psychology around it. And we just have to keep going back to, you know, like, here's what we know. My tendencies are this, but I know I am best when I do this, or right. And I do deserve to, I am worthy enough to sit at that table. I've had to learn that over time. That whole being worthy and what that looks like, and go for it. So thank you for this beautiful wisdom, not just about life and parenting and marriage, but about the heart and women's health. And again, heart health. And I cannot thank you enough for just providing such practical, easy to understand, easy to comprehend information. You have a gift and of just making us allowing us, helping us to understand, and making us feel like making us feel that we're understood, because that's hard. You know, that's really hard, that what we're experiencing is real. It's not a fake thing, and that we are made, uniquely and wonderful, made in the image of God, and very specially as women. And that's going to look a lot different than our male counterparts in life. And so thank you for that. And thank you for taking the bold step to follow your passion and to do what's next. And we're going to be cheering you along the whole way. Cannot wait to do a follow-up podcast and with the questions that are sent in. And then also a follow-up when you do, whatever that next thing is, we're going to be right there ready to hear all about it. So thank you so much, Dr. Giesler. I'm so grateful for you. Appreciate you.
Ooh, I appreciate this opportunity so much. Thank you.
Absolutely. We're going to do it again.
I can't wait. Thank you. And thank you for everything you're doing.
Oh, absolutely. My honor and privilege and pleasure. Thank you. Thank you for listening to the Power of We podcast. And if you happen to be in Austin or San Diego, we would love for you to join our fitness community. But if not, I would love for you to join me and our at-home fitness community. Most importantly, thank you for being part of the Power of We family.